Hi, good morning.
Hi.
Hi. So my understanding is this question is about the pros and cons of a needle exchange program. Is that right?
That's correct.
So just to summarize what a needle exchange program is, these are typically programs that are designed in cities where people can bring in their used needles to get fresh needles, really no questions asked. Is that correct?
That's correct.
So some of the pros here are that with intravenous drug use, there's a lot of risk for spread of diseases like HIV and hepatitis and other bloodborne diseases. So by providing a free needle exchange program, this should theoretically decrease the spread of these diseases since people would be using fresh needles. So that's probably the biggest pro of the situation. Some cons might be that some people might think that this is encouraging drug use or otherwise illegal activity by somehow condoning the behavior by offering a resource for it. I think maybe another pro to this situation is that people that are intravenous drug users or otherwise illegal activity are often not comfortable seeking medical care. So this is an opportunity for healthcare workers to at least exchange in some kind of dialogue with these people. So even if they're picking up a needle, there's an opportunity for more resources like education, access to healthcare screenings and things like that that would otherwise be unacceptable to these people. I think maybe another one of the cons is that you open up perhaps some legal responsibility in the issue. Is that what is the city's responsibility, or if it's a physician-run facility, what are their responsibilities in educating these people or treating them if they come across different medical issues with these people?
Okay. Great. So let's say that there's a needle exchange program that's going on in a certain city, and as you mentioned, there's certain legal responsibilities or implications in these situations. Let's say the clinic is ran by a physician, and the physician authorizes that exchange of needles, and the physician distributes needles, and a patient comes in, gets fresh needles, and then goes out, uses them for intravenous heroin and overdoses and dies. Whose responsibility is that?
That's a difficult question. I think it's not cut and dry, and there may be some legal issues or principles that I don't fully understand. But I think if we use the scenario of, let's say, a grocery store and somebody goes into the grocery store and purchases a knife and maybe wounds themselves or somebody else with the knife, I think generally speaking, we don't think that the owner of the grocery store is responsible. It's the responsibility of the person that purchased it. That being said, I think physicians are held to a much higher standard. So supposing that the physician was in charge of the clinic with the free needle exchange, I think if they did their due diligence to provide resources and education and safe usage of the needle, then ultimately it's not their responsibility. That being said, I can see where there might be a gray zone here. Ultimately, I think it's not the responsibility of the physician or anybody in the clinic. It was simply up to the person, whether they got a clean needle from the clinic or a dirty needle from somewhere else. They made the decision, and I think it's just an unfortunate circumstance.
All right, great. So let's debrief a little bit here. Overall, I think that you did a good presentation as far as repeating the question, making sure that you knew exactly what this was asking. I think that's important here because as a pre-med, you can often get mixed up on some details or maybe not even fully understand what the question is asking. So I think that was really good that you took the time to make sure you understood what was being asked of you before starting to answer. You did a nice job of talking about the pros and cons and kind of just staying straight to what the question is asking here instead of, going off into different scenarios or kind of putting your own 2 cents into it. You really just talked objectively about the pros and cons. And then with the follow-up question, I think you did a nice job as well, because this can be a question that maybe is a little alarming to people. You did a good job just kind of keeping clear-headed, calm and just trying to answer the question as much as possible. And I think another really important aspect here that you did well is that you realize that there may be stuff you don't know. And that's okay in these types of scenarios. If they're asking a legal question and you don't know the answer to it, or you think there could be more to it, it's okay to say you don't know. And that maybe you would talk to other people, or there's just some things that you're just not completely familiar with. How do you think you did?
Good. I think the biggest pitfall in a question like this would be to interject your own opinion and say, like, I don't think that this is something that should be offered, or I think this is the best solution to a problem, but just equally weighing what's good about it, what's bad about it.
Absolutely.